Mr. Iyer is asking me, can slip disc be permanently cured? I think this answer coming from a surgeon would be more appropriate, but yes, from our experience as therapists, we don't know that it can be completely cured, provided at which level your slip disc is. If you mean non-operatively or operatively, is the question you're trying to ask. It's a call we'll need to make only after we have seen most of your investigations and clinically assessed you at which stage of slip disc you are. But irrespective of what line of treatment you take, exercises are going to be important, and to make sure that your back is strengthened and whatever problem you have presently does not recur. Okay, Mr. Bhojraj, you're very specific about your disc which is protruding. So, like I said, if for this kind of a case, we would, before putting you onto any kind of a program, we would obviously want to collaborate with a spine surgeon. So, we need to have an idea from him whether what is the level of your protrusion, whether it is causing you any neuropathy, neural, what do you say, the neuro component, how much nerve compression is happening, whether it is, level 1, level 2, level 3, like we medically put it, which level is your slip disc at before we are able to put you onto any kind of program. Or so at least a basic MRI would definitely be needed. Yes, Swapnil, our entire lecture today was structured for, sedentary job profiles. So working from home, like I said, first of all, take a look at your, work station, as we say, your table, your chair, how you're using your laptop, whether it's of the correct height or not. Use the guidelines that we have given today. If you have neck pain at the end, uh, first of all, apply ice. Okay, ice fermentation. You could even do heat fermentation if you require, but for this kind of a neck pain, usually ice works better. So apply it at the end of the day. You'll feel the muscles relaxing because they basically become tight at the end of the day. So try to relax that with the ice fermentation. Intermittently do the stretches that we have shown you for the neck, and also there are further strengthening exercises which will help you. So do visit a physiotherapist and take down on program. Okay. Hi, Dr. Nikhil. So you are going to be a doctor. Good for you, or bad for you. I don't know which one, but yes, medical professionals do face a lot of back pain. Some of the stretches, Nikhil, that we demonstrated today will definitely be helpful if you try them. Especially when you're standing for long hours, try to do the stretches that we have shown in the, standing position. Also, if possible, the standing position, the variation and the height of the surfaces which I have spoken about, try to incorporate that with whatever available resources that you have. And also you need to get into a proper back strengthening program. Now, to demonstrate all those exercises in one particular session would be difficult, because remember, uh, because a back ache or back pain, even though biomechanical, could be because of different muscles being weak. So an assessment by a therapist as to which muscle is actually weak is extremely important before you put you on any exercise regime. So please do visit one of the therapists close by. Let them assess you for your weak muscles and put you on a strengthening program. But yes, given your profile, whatever stretches we have shown you today will definitely help you. Yes, most definitely, Mr. Deshpande. Physiotherapy is definitely helpful in slip disc. Again, like I said, depending on the level of slip disc, whether you have been advised surgery, not advised surgery, taking from there, if you are operated post-operatively, you would require physiotherapy to make sure that operated muscles are strengthened and further weakening of the rest of the vertebrae doesn't happen. And if you are in a stage where surgery is not required, exercises are extremely important, so that we are able to develop the muscles in such a way that they act like a kind of belt around your spine and give it the protection and the support that it requires. So yes, physiotherapy, definite help.